Joining us once again tonight via Skype, Dr. David Kirschke. He's the medical director for the Northeast Tennessee Regional Health Department. Dr. Kirschke, thanks again for joining us. You are just such a good resource for us.
Sure, thank you.
Well, the state started releasing some numbers today regarding COVID-19 clusters in nursing homes. No facilities were on the list in our region. Do you expect that to continue?
Well, actually, as the economy reopens and that we get more cases, we expect a surge in cases in our region. One of the main groups we're worried about are nursing homes because we have a lot of people that are high risk, either because of age or medical conditions or both. And we've seen elsewhere in the country and within the state large outbreaks in nursing homes. So we are, now that we're not doing weekend surge events for the public with testing, we are concentrating on nursing homes. So we do expect to have lots of testing going on in nursing homes in our region. So we'll just have to see if we find cases.
Right, it's really hard to predict these things. I know we ask the questions and you can't tell the future, but you know, your educated your information, your educated guess, it means a lot. Well, we can go to prisons now too, because every inmate, according to Governor Lee, in state prisons are going to be tested for COVID-19 as well. Are we starting to see any numbers from that yet?
So I'm not aware that the testing has started in Northeast, so the facility in Johnson County, but there have been very large outbreaks elsewhere in the state. So we do expect testing to start there soon. We've not been told when. Possibly it started without us knowing about it. But I would say, I just want to remind people too that prisons are different than jails. So our county jails, currently we don't have plans to do large scale testing there, but we have been testing anyone that's sick in the jail. So we've been working with all of our jails in our counties. If they have inmates that are sick that have symptoms that could be coronavirus, we're helping them get those people tested because we are very concerned about jails as well as nursing homes.
That's a good point. I'm glad you brought that up. Obviously, it's graduation time and parents are wanting their children to have that experience. They want to see their children in a graduation ceremony. Some schools are still planning to hold a somewhat traditional ceremony later in the summertime, maybe in smaller groups. What do you think about this happening? Should parents maybe temper those expectations a little bit?
Yeah, so we've been talking to schools about that. So again, as we reopen, we do expect there could be a surge of cases. So, you know, within as little as 6 weeks, we could have lots of cases of coronavirus. So I would just tell schools and parents to be flexible. I know as parents, we definitely want to see our children in that ceremony, but also doing what's safest for the children and also for the parents that would be potentially in the audience. So I think, yeah, it'd be important to be flexible. We'll just have to see where we are in that, you know, by middle of summer.
Flexibility, kind of the name of the game these past few months, that's for sure.
Yeah.
Okay, so you've been out at some of the testing sites in our area recently. How is that process going? I'm sure the medical professionals have got it down to a science. From your perspective, how smoothly are those going?
Yeah, so we do have still National Guard that are assisting us with testing, along with our health department nurses and other staff. Yeah, it's been going really smoothly. Our last weekend events occurred this past weekend in Carter and Unicoi counties. And so going forward, we would still have testing 5 days a week at all of our local health departments, county health departments, and the National Guard is assisting us with some of that. But it has been going smooth as we go along. We're getting more efficient. There's not really wait times or anything like that that are significant.
That is good news. Let's talk about personal protective equipment here for a second. I know at first what we were doing when we were quarantining is making sure that our medical professionals had everything they needed in case the numbers went up. We're flattening the curve. Is personal protective equipment still a concern, or have we caught up, or do we have enough resources to keep our medical professionals safe?
Yeah, so currently we have enough, but as we know, we've kind of flattened the curve currently. So things are pretty stable. We seem like we have enough now. The question is, you know, when we get to if we get to a big surge, will there be enough at that point? we are still getting questions from nursing homes and first responders about having difficulty ordering PPE through their normal channels. So they are coming through us. We do not have a large stockpile of PPE if we were to get into a big surge. And, if there is a big surge statewide, everybody's going to be looking for PPE. So it is still something we're concerned about.
Dr. David Kirschke, Medical Director for Northeast Tennessee Regional Health Department, thanks once again for joining us tonight.
Thank you.